Welcome to our channel, where we provide expert advice and practical tips to help you manage your livestock health and keep your farm thriving. Whether you raise cattle, sheep, goats, poultry, or any other farm animal, keeping them healthy and free from disease is essential to your success as a farmer. In today's video, we're going to talk about common livestock diseases, and more importantly, how to prevent them. Livestock diseases are not only devastating for animals, but can also lead to financial losses, decreased productivity, and even the potential loss of entire herds. While diseases can't always be avoided, there are many effective strategies and preventative measures that can reduce the risks significantly. This video is a comprehensive guide to help you identify, understand, and prevent some of the most common diseases in livestock. We will cover a variety of diseases that affect different types of farm animals and provide in-depth strategies for keeping your animals healthy, reducing the spread of infections, and ensuring the success of your farming operations. Let's dive right in and learn how you can protect your livestock from common diseases. Bovine respiratory disease, BRD, in cattle, causes and prevention. Bovine respiratory disease, BRD, also known as shipping fever, is one of the most common and serious diseases affecting cattle worldwide. It's a multifactorial disease caused by various pathogens, including bacteria, viruses, and environmental stressors. The disease is most commonly seen in young cattle that have been transported or introduced to new environments, which makes it a significant concern for commercial cattle operations. Causes of BRD. BRD is often caused by a combination of viral infections, such as bovine herpes virus, bovine respiratory syncytial virus, BRSV, or para-influenza 3 virus, and secondary bacterial infections, like Mannheimia, Hemolytica, and Histophilus somni. Stress from transportation, weaning, or poor environmental conditions, such as poor ventilation or overcrowding, weakens the cattle's immune system, making them more susceptible to infections. Symptoms of BRD: coughing, nasal discharge, clear to thick and yellow, fever, lethargy and decreased appetite, rapid or labored breathing. Prevention strategies: vaccination. Vaccination is the most effective preventative measure. Make sure your cattle are vaccinated against the major viruses and bacteria that contribute to BRD, including BRSV, para-influenza 3, and Mannheimia hemolytica. Work with a veterinarian to create a vaccination schedule tailored to your farm's needs. Reducing stress. Since stress is a significant risk factor for BRD, minimize transportation times, avoid overcrowding, and provide cattle with enough space, proper nutrition, and water. The more comfortable your cattle are, the less likely they are to become sick. Environmental management. Proper ventilation and clean bedding are essential to reducing the risk of respiratory diseases. Cattle should be kept in clean, dry environments with proper airflow to reduce exposure to respiratory pathogens. Early detection. Regularly monitor cattle for signs of illness and act quickly if any symptoms appear. Early treatment can prevent the disease from becoming more serious and can save your livestock. Foot and mouth disease, FMD, in livestock. How to prevent this contagious disease. Foot and mouth disease, FMD, is a highly contagious viral disease that affects cattle, pigs, sheep, goats, and other cloven-hoofed animals. The virus can spread rapidly through direct contact with infected animals, contaminated feed, and even through the air in some cases. FMD can result in severe losses in livestock production due to reduced milk yield, poor weight gain, and even death in some cases. Symptoms of FMD: blisters and lesions on the feet, mouth, and udder, lameness and reluctance to move, fever, excessive salivation, drooling, loss of appetite, decreased milk production. Prevention strategies: quarantine. If you suspect FMD on your farm, immediately isolate the affected animals from the rest of the herd and call your veterinarian. FMD spreads easily, and early quarantine can help prevent an outbreak. Vaccination. There is a vaccine available for FMD, but it's only effective against certain strains. In regions where FMD is common, vaccination is an important preventative tool. Be sure to consult your vet about the most appropriate vaccine for your farm's needs. Biosecurity. Maintain strict biosecurity measures to prevent the introduction of FMD into your herd. This includes controlling the movement of animals, implementing proper sanitation for equipment and vehicles, and ensuring that any workers or visitors to your farm follow proper hygiene protocols. Surveillance and reporting. Regularly monitor your animals for symptoms of FMD and report any suspected cases immediately to local agricultural authorities. Early detection and reporting are key to controlling outbreaks and preventing widespread disease. Avian influenza, bird flu in poultry. Prevention and control. Avian influenza, AI, commonly known as bird flu, is a viral infection that affects poultry, including chickens, ducks, and turkeys. Highly pathogenic strains of the virus can cause sudden death in flocks, while low pathogenic strains may cause mild symptoms or none at all. Bird flu is a major concern in the poultry industry because it can spread quickly and result in significant economic losses. Symptoms of avian influenza: sudden death in birds, swelling of the head, neck, and eyes, respiratory distress, coughing, sneezing, diarrhea, reduced egg production, cyanosis, blue discoloration of combs and wattles, prevention strategies, biosecurity measures. One of the best ways to prevent AI is through strict biosecurity. Prevent wild birds from coming into contact with your flock, as they are a primary vector for the disease. Keep feed, water, and equipment clean and disinfected, and limit access to your farm to essential personnel only. Surveillance and monitoring. Regularly monitor your birds for symptoms and conduct testing when necessary. Surveillance programs in your region may offer early warning systems to identify outbreaks before they spread. Vaccination. While vaccines for avian influenza are available, they are not always 100% effective against all strains of the virus. However, in high-risk areas, vaccination may be used as part of a comprehensive disease control plan. Control measures. If an outbreak occurs, immediately isolate and euthanize affected birds to prevent the spread of the virus to healthy animals. Work with local authorities to ensure proper disposal of infected carcasses and decontamination of the premises. John's disease in cattle and other ruminants. Prevention and management. John's disease, also called paratuberculosis, is a chronic bacterial infection that affects the intestines of ruminants like cattle, sheep, and goats. The disease causes severe weight loss, diarrhea, and reduced milk production. It is a slow progressing disease, which means it can take years for symptoms to become apparent, making it difficult to diagnose in the early stages. Symptoms of John's disease: chronic diarrhea, weight loss despite normal or increased appetite, reduced milk production, thickened intestines, as seen in post-mortem examinations. Prevention strategies: testing and culling. Implement regular testing of cattle and other ruminants for John's disease. Infected animals should be culled to prevent the spread of the disease to healthy animals. Focus on testing animals that are showing clinical signs or are at higher risk, such as older animals or those with poor production levels. Clean calf management. The bacteria responsible for John's disease are shed in the feces of infected animals. To prevent the transmission of the disease, make sure your calving area is clean and separate infected cows from young calves. Ensure that calves are not exposed to contaminated manure or bedding. Good hygiene practices. Maintain high standards of cleanliness, especially in areas where cattle feed and drink. Proper sanitation helps reduce the risk of exposure to the bacteria. Vaccination. While there is no perfect vaccine for John's disease, vaccination may be considered as part of an overall herd management strategy. Consult with a veterinarian to determine the best course of action for your herd. Internal parasites in livestock, control and prevention. Internal parasites such as roundworms, tapeworms, and liver flukes are a significant threat to livestock health. These parasites can cause poor weight gain, decreased milk production, and overall weakness. If left untreated, they can even cause death in severe cases. Symptoms of parasite infestations: weight loss or poor growth rates, diarrhea or bloody stools, lethargy, swelling, particularly around the abdomen in the case of bloating. Poor coat condition. Prevention strategies. Deworming programs. Regular deworming is essential for controlling internal parasites. Work with a veterinarian to develop a deworming schedule appropriate for your species and region. Fecal egg counts can help determine the level of parasite infestation and guide treatment decisions. Pasture management. Parasites often live in the pasture, so rotational grazing can help reduce the buildup of parasite larvae. Allow pastures time to rest and regenerate, and avoid overgrazing, which increases parasite risks. Good hygiene practices. Clean water and feeding areas regularly to prevent the contamination of feed and water with parasite eggs. Manure should be removed promptly to reduce the chances of parasite eggs hatching and reinfecting your livestock. Monitoring and early detection. Regularly check for signs of parasitic infestations, especially during high-risk seasons. Early detection allows for prompt treatment and prevents widespread issues. Proactive measures for healthy livestock. Preventing common livestock diseases requires a proactive approach, from vaccination programs and biosecurity measures to good management practices and regular health monitoring. These strategies can significantly reduce the risk of disease outbreaks on your farm. By keeping your animals healthy and disease-free, you not only protect your investment, but also ensure that your farm continues to thrive. Thank you for watching. Don't forget to like, comment, and subscribe for more expert tips and in-depth discussions on livestock health. Stay tuned for future videos where we'll explore more disease prevention methods and specific disease management strategies.